we'll give it 10 more seconds while we let in. We are expecting quite a lot of people in today's session. So again, if you've just popped in, if you wouldn't mind putting yourself on mute, that would be fantastic. And we are going to get started. Kate, you're recording, aren't you? Thank you. Okay, it is 12 o'clock. Thank you, everybody, and welcome to today's Lunch and Learn session. My name is Kathy. I'm one of the directors at Thrive Aged Care Consultants. We've got Kate in here who is letting everybody in the chat in the program and is recording today's session. So you will get a copy of this recording at the end, and it will be up on YouTube if you want to share it with your teams. And we are really excited today to have our guest speaker, Melissa Angelone, who is waving up in the corner. Now, Mel is a very experienced mental health clinician with nearly 20 years experience, and she's worked in a variety of settings, in mental health settings, in supporting aged care facilities, and lots of other roles, but all based around supporting people with their mental health. So today we're obviously going to be talking about trauma-informed care, and this is by far our biggest group. So I think clearly there's a lot of interest out there about what trauma-informed care actually means. And that's probably because it's a term that is reasonably new to some of us who work in aged care settings, some of us who work in health settings. But it's not necessarily a new term to mental health settings, which is why we have the lovely Melissa here talking today. So while the actual term itself might be something that is a bit overwhelming and got us thinking, how are we supposed to do that as well as everything else we do? Is it actually a new concept, or is it just something that we have named differently and is trying to raise a bit more of our awareness about? So today, I'm going to hand over now to Mel, and she's going to run us through, in this half an hour, a bit more about what trauma-informed care actually means. So just some housekeeping as well. If you've got any questions, please just put them in the chat. We won't have a general conversation because it is only the half an hour, but please do put your questions or comments in the chat and we will be monitoring that. Okay, thank you. And over to you, Mel.
Excellent. Thanks, Kathy. So hi everyone, just a really brief introduction again. I know Kathy did introduce me, but so my name is Mel. As mentioned, I am a mental health nurse. I've spent probably the last 15 years of my career working in the older adult mental health space. So I'm really grateful and really excited to be here today to talk to you guys about trauma-informed care, because as Kathy mentioned, it isn't something that is new for us in our space, but it is something that we're seeing become more and more prevalent, and there's a lot more interest in the aged care sector. So I'm very grateful to be here to talk to you. Before we jump into the presentation, we will just do an acknowledgement of country. So I would like to begin by acknowledging the traditional owners of the land on which we are all meeting today, and pay respects to their elders past, present and emerging, as well as any other Aboriginal people or other communities who may be present today. Okay, so just before we get started, I think it's really important to acknowledge that some of the topics and themes that will be talked about today can be potentially upsetting or uncomfortable for some. The reality is, particularly as we age and go through a life, most of us have experienced some level of trauma, whether it's impacted us directly or vicariously. So there may be things that will be discussed today that may be quite confronting for some. So if at any point you do feel uncomfortable, please feel free to step out. And if you do have any questions or concerns that you'd like to talk about after the session, I'm happy to wait around if anybody would like to chat about anything. And next slide, please. So what is trauma? So before we jump into the concept of trauma-informed care, it's really important that we actually understand what trauma means and how it varies for us as individuals as well. Next slide, please. So there are many definitions that you will find, but I found that this one was probably the most basic in explaining what trauma is. So trauma is very much a psychological or emotional response to an event, experienced by an individual that can be distressing or disturbing. Now, it's really important that we highlight individual, because we could all, for example, be present when there may have been, say, a staff assault on the unit, but we will all respond to that differently based on our own individual coping mechanisms that we've developed throughout life. So it can result from a single event, such as an accident, assault, or natural disaster, or it can be caused from ongoing experiences such as abuse, neglect, or exposure to violence. So again, somebody can be traumatized from, say, that one-off incident where a staff member, say, could potentially be assaulted on a unit, or you may have had a house fire that results in significant trauma because of loss of your livelihood. Or it could be an individual that has been experiencing verbal abuse for a number of years, and that has resulted in ongoing trauma. Next slide, please. So if an individual does not have protective factors in place, so protective factors are, for example, and I will keep going back to the example of assault in a workplace, because from a mental health perspective, that is quite a common occurrence. So unfortunately, protective factors are usually things like a really well supported network. So whether that's your team, your manager, loved ones outside of work, so family, friends, things that you do to basically feed yourself. So self-care, going to the gyms, doing things that you like. They're all protective factors, and they can either protect you from experiencing that trauma, or if you do actually experience that trauma, whether it be directly or vicariously, it assists you in moving through it. So these events can have an impact on a person's mental, emotional, and physical well-being, and can lead to feelings of fear and helplessness, and can affect the individual's sense of safety within their environment. Trauma can also affect an individual's ability to regulate their emotions, form healthy relationships, and cope with stress. So again, this is dependent on the type of trauma and how long you have been affected by it. So from a mental health perspective, for example, if you as an individual have been abused as a child and it has continued on for a number of years, that does affect your ability to regulate your emotions. So as you grow into an adult, you struggle to form basic relationships, you struggle to seek help in appropriate ways. You don't have the ability to ask for help. So you may have heard of people who self-harm, and that gets referred to as attention seeking. Unfortunately, it is because they're not able to regulate their emotions, and therefore they do that as a way to deal with the trauma, but also to seek support. Next slide, please. So it's important to note that each individual that experiences a traumatic event will respond differently. So, and this is something that we will continue to reiterate, because based on ourselves and as individuals, how we were raised, what environment we grew up in, have we been exposed to any other types of traumas, that will affect you and how you experience trauma throughout your life. And again, we're all human, we are all adults. Nobody goes unscathed. Everybody has some either level of trauma or vicarious trauma. What may be traumatic for one person may not be traumatic for another. Next slide, please. So trauma can be complex and can manifest in a variety of symptoms. So these are some symptoms, but again, it's not limited to. So flashbacks, nightmares, anxiety, depression, and difficulties with memory or concentration. So difficulties with memory and concentration usually correlate with depression and anxiety, and that can form directly from a traumatic event, again, based on the type of trauma and if it's ongoing. And if you're not able to seek help, or you're not able to self-soothe or regulate, it can develop into a depression or an anxiety. Flashbacks and nightmares, if we think about our war veterans and we hear PTSD spoken about, flashbacks and nightmares are very, very common in that cohort. And again, if we think about the cohort that we work with for the clinicians and individuals that are here from the aged care space, this is something that you do need to be very mindful depending on an individual's response to trauma and the symptoms associated for the treatment of trauma. So usually, again, depending on the type of trauma it is, therapy is usually first line. So I mentioned before, individuals who have a history of ongoing trauma from an abuse perspective, therapy is something that is regularly recommended. And the one we've talked about here is cognitive behavioural therapy, which usually goes for 12 to 18 months. So it is a significant period of time. They usually meet with the clinician weekly and they go through the traumatic event and how to actually create coping mechanisms to help them move forward from that. Next slide, please. Okay, so now that we have I hope we have a better understanding of what trauma is, we then look at what is trauma-informed care. So as Kathy mentioned, this is sort of a taster and an opener to what it is, because trauma-informed care is obviously something that we would need quite a bit of time to talk about. But a basic example or a basic definition of what it is in the context of healthcare. So it's an approach where we recognise and respond to the idea that trauma has a widespread impact within our greater community. So again, the idea that most, if not all, people have experienced some level of trauma throughout their life. So general community, and then they're coming into our healthcare space. So we need to think about the impacts that this will have on patients that we meet, carers that we meet, or loved ones, as well as to start working with these individuals, and thinking about how that trauma will potentially affect the patient and carer's journey while they're with us, or residents if they're residing in facilities that you're working at. How do we then identify signs and symptoms of the trauma for each individual, and then how can we look at our current policies and procedures and embed better practice so that when we do have individuals who have presented with some sort of history of trauma, they're able to get the best care possible. And I will use the term person-centered care because I know it does get thrown around a lot, but in this context, person-centered care is vital when we're looking at trauma-informed care, and making sure that we're creating also a safe environment so that whatever has previously traumatized them doesn't actually exacerbate or re-traumatize them while they're with us during their experience. Next slide, please. Okay, so we are going to show you a really quick 3-minute YouTube video. For anyone who's seen me present before, I love YouTube. I think it's a great way to provide another type of learning because it's usually animated and it changes up the voice, and there's usually some goodies on there. So this particular video is about, it gives a brief definition of trauma-informed care, and it talks about 5 strategies that we can consider when implementing trauma-informed care in our workplace. So we'll quickly review the video and then we'll talk about those 5 suggestions in more detail. Thanks, Kathy.
Sorry, Kathy, we can't hear sound. Can you pause that?
The old saying, don't judge a book by its cover? Well, the same is true when you assess a patient. Hi, I'm Dr. Cruz. Early in my career, I noticed a pattern with some of my patients. They often had multiple health issues, were uneasy during office visits, and frequently visited the emergency department. But worst of all, they never got better despite multiple visits. Then I realized something. From an early age, many of my patients were exposed to trauma and adverse childhood experiences, or ACEs. This includes emotional, sexual, or physical abuse, violence, neglect, discrimination, poverty, and other adverse events. ACEs are more common in the US than you'd think. In fact, 60% of US adults have one ACE, 25% have 3 or more ACEs, and 16% have 4 or more. ACEs occur in all socioeconomic groups, but are more common in low-income and minority populations. For young children, repeated exposure to trauma can impact brain development and literally rewire the brain's response to stress. So as they grow up, many struggle with issues related to emotional regulation, like depression, anxiety, or substance use disorders. Trauma survivors are also more often at risk for chronic diseases, behavioral health problems, and even suicide. Knowing all this, I began to rethink my approach to care. Instead of asking patients, "What's wrong with you?" I ask, "What happened to you?" Recognizing that life experiences are often a root cause of poor health is integral to improving patient care. Trauma-informed care has helped me take these experiences into account, providing greater insight into my patients' needs and how to address them. Here are 5 key ways that healthcare organizations can gradually integrate trauma-informed care into their practices to help patients and staff. First, build awareness and generate buy-in. Involve both staff and patients in adopting a trauma-informed approach. Second, invest in a trauma-informed workforce. Hire staff that embrace trauma-informed care and provide training not only for clinical staff, but also for non-clinical employees like front desk workers or security guards, who are often the face of your organization. Next, create an environment that is safe and welcoming for patients and staff. Engage patients in meaningful ways. Ask how they feel and listen. You can also build trust by involving them in their own treatment planning. Finally, identify and treat trauma. Consider a screening approach that works for your patients and ensure that treatments and referral sources are available. These changes take time, but each step improves our ability to connect with and care for patients. Today, our patients appreciate the changes we've made. Plus, our staff is more in tune with patients, so work is less stressful and more rewarding. Trauma-informed care. It can truly transform the caregiving experience from being treaters to being healers.
Perfect. Thanks so much for sharing that, Kathy. So I hope you guys found that useful. As I said, I think it's just a nice way to kind of break up the presentation, and it talked a little bit more about types of trauma and how we can integrate trauma-informed care into our clinical areas. And I'm mindful there is a varying amount of clinicians and clinical areas that are present today, but we'll try and cover as much as we can in the time left. So Kathy, happy to go to the next slide, please. Okay, so if we think about how we can integrate trauma-informed care practice into our clinical areas, and what does that actually look like? And one thing I want you to focus on is, what are we already doing? Because you'd be surprised, you're actually already doing a lot of this stuff. So even though we mentioned at the start, mental health, the mental health space has been doing trauma-informed care for a lot longer formally. Informally, you guys would do this on a day-to-day basis and you probably don't even realize. So if we think about the 5 areas that were discussed in the YouTube video, we're just going to expand on those briefly. So build awareness and buy-in. And this is a really important one. So this is about identifying that there is a need for trauma-informed care, which obviously there is, because there's so many of you here today, which is great. And begin providing info to staff and carers. So what we're seeing at the moment is there are organisations across the board that are looking at either employing individuals or clinicians who are skilled in this space, and looking at building programs within their services and teaching their staff more about trauma-informed care. So we do know that this is actually already happening. Another way that you can build awareness is providing patient pamphlets or even booklets to your staff, just identifying this is actually what trauma-informed care is in terms of a basic definition. And again, what you'll be very surprised at the fact that a lot of this work is already happening in your services. The next point, Kathy, thank you, is to invest in a trauma-informed workforce. So again, I've just briefly mentioned about there are services that are looking at employing clinicians and educators to build up a package around trauma-informed care and actually presenting that to their organisation. So staff do feel more confident in this space, even though, again, stuff is probably already happening informally. It is one of those areas where people will want further education. And this is coming from a mental health background, that even a lot of our staff that we inadvertently are trained on a lot of this stuff in our training, our clinicians still want a lot more information, so they feel a lot more comfortable in this space. So one thing to also think about is your interview processes. So if you're looking at investing in a trauma-informed workforce, think about the clinicians or the staff that you're employing. You can actually add some sort of questionnaire or a particular question in your actual interview questions to see if your individuals have an understanding of what trauma-informed care is or how they can reflect on that and what can they bring to the clinical space. Kathy, did you want to add something?
So I was just going to ask you, Mel, with the education in the mental health setting around trauma or trauma-informed care, what kind of topics do you cover? Like, sorry, I put you on the spot, but like, what kind of things should we be looking at if we're working in aged care and we're wanting to implement, we wanted to teach our staff about trauma or trauma-informed care, like what would we start with?
That's a really good question. So we usually talk about what trauma is, and we would go into a lot more detail, the types of trauma, and once we've identified that level of trauma, how we would actually do it from our perspective. In an aged care setting, it would be more about helping staff identify residents that may be experiencing some sort of trauma. So whether that is, further education with individual staff members, and that's not just clinical, non-clinical as well. So looking at how do we identify trauma, when we identify trauma, what do we actually do with that? So how can we support the individual? How can we support staff? Again, trauma can be vicarious. So you may have a resident who discloses that they were abused as a child, and this is the first time that they've talked about it because they've actually got a dementia and they've regressed and they're now talking about it. So they themselves, we're not clear on how they're processing it, and vicariously that can affect staff because they may not have been exposed to that sort of information or that particular type of trauma. So it is, I think I'm now going on a tangent, but it would be very much about defining what trauma is, thinking about how do we identify that in our residents, and ways to actually support our residents and staff and loved ones as well, because again, carers are just as important in that process. That kind of...
Yes, thank you.
Yeah, no worries. I might move on to the next point if that's okay. Thank you. So creating a safe physical and emotional environment was the third topic that was raised in the video. Now, this is one where, again, from a mental health perspective, is something that we've been doing for an extended period of time. So I know in aged care facilities, some facilities have the snoozle-in rooms, or rooms where residents can sort of have some one-to-one time with, whether it's some sort of sensory items or sensory rooms, I should say. So, and one-on-one time with staff to kind of de-escalate any behaviours of concern that they may be presenting with, resulting from, a particular trigger or an unmet need. So within mental health, we're really big on providing either sensory rooms, snoozle-in rooms, areas that promote quiet time to give individuals that space to actually decompress. And if they're wanting to engage with staff one-on-one, it's a safe space to do that. keeping in mind, if you do have residents or patients in your settings that do have a history of trauma, whether it be, say, for example, if it's physical abuse or sexual abuse, being really mindful of the staff that are caring for them. So if it was a male perpetrator, if possible, if they can only be cared for by female staff. If they've got shared rooms, ensuring that it's a female-only room. Some mental health facilities have female-male corridors. So just, again, to keep in mind for individuals that may have experienced abuse. So from a physical perspective, that's some of the examples we use to keep the environment safe, but then safe in general. So we know that, and I shouldn't keep using the example of mental health, but the reality is, unfortunately, at the moment in the mental health space, there is a lot of verbal and physical aggression. So it's also about how can we keep the environment calmer and safer for the whole cohort of patients, as well as visitors and staff. The next point, please, Kathy. So engaging patients meaningfully. So this is, again, where person-centered care will come up. And I know for some people it is a bit of a throwaway line, but person-centered care, when done well, is fabulous. We know that consumers need to be involved in their care, that we always get better outcomes. From a mental health perspective, we've taken on the model of bedside handover as well, which I know the general nurses were doing it long before us, but it is something that we've integrated into our practice, and we do find that it does give that safe space for consumers to actually be more involved in their care, and that, you know, gives them the opportunity to ask questions, to clarify things, and again, that tends to provide better outcomes for their health. The other thing to think about is, with engaging patients meaningfully, is treatment planning. So again, yes, bedside handover is wonderful, but when we're actually doing their care plans, you know, if they are cognitively intact, I know with, you know, individuals with dementia, it's a little bit harder, but we would engage their carers in that space and using them to, you know, from a meaningful perspective, engaging them for better health outcomes, yes, but also a space where they may be able to tell us, look, Dad was assaulted when he was younger and he's never quite wanted, you know, he's never really talked about it, but now that he's starting to dement, he's expressing it a lot more, and, you know, what can we do to support him? So it is, you know, we do definitely engage patients meaningfully, but obviously we need to consider their loved ones also. And the last point in this space is identify and treat trauma. So once we have actually identified it, what can we do? So from a residential aged care facility space, there's a couple of things you can do. I'm sure most of you are aware of basics. So the mental health teams for your local areas, but that's dependent on their level of risk. So I'm sure you're all aware everything based on risk. So if they're not presenting it as a significant harm to self or others, they may not be appropriate for basics. The other organisation that I would highly recommend, and this is for all cohorts, so all age groups, it's called Partners in Wellbeing. It is a free service. It is a federally funded program that really surprises me that a lot of people still don't know about it. So there are community hubs set up all across Victoria, so metro and rural. If you Google Partners in Wellbeing, it will tell you to pop in your suburb, and individuals can either self-present at the hub or they will do assessments over the phone, and it is staffed by all mental health clinicians. So for residents in aged care facilities, they can be assessed and treated over the phone. If they're not cognitively intact, it may not necessarily be appropriate, but if they are struggling with depression and anxiety, and obviously in this context in relation to trauma, they are staffed and very experienced clinicians, and they're very happy to help. If you are on a medical ward, I'm sure most of you are aware or liaise with consultation liaison psychiatry. So please reach out to them if you have any questions or concerns around an individual who may have a history of trauma and you're not quite sure what to do about it, because it is very confronting. Most general clinicians aren't trained in this space. I previously had worked on CL Psych, and it's probably one of my most cherished roles, and I loved going in and providing support to staff because it is not something that you're usually familiar with, and it can be quite confronting. So please reach out to those teams. Mental health clinicians are always available to help and really want to help. And I think that's all of them. So just a quick summary, because I'm mindful of the time. So trauma is a psychological or emotional response to an event experienced by an individual that can be distressing or disturbing. Someone's just made a comment about the acute ward. I'll jump back to that in 10 seconds. So just keep in mind, trauma is very individualised. It can result from a single event, or it can be related to an exposure to an ongoing event such as abuse or neglect. Trauma-informed care is a reasonably new term or concept for the general health care or aged care, but it has been in place in mental health for many, many years. And even though it is a new term for this space, it is something that as I said, you're already doing it in some capacity. So I think it's really important to acknowledge that also. Okay, so I might just jump back. So just to check, was the question of what to do on an acute general ward? Is that what it was?
Yes.
Yeah, cool.
Yes,
so if you're on an acute general ward or GEM, TCP, any medical ward, there is a fantastic team called Consultation Liaison Psychiatry. This is for all public health services. I know some private hospitals do have CL, but it's not as big of a team. So CL usually consists of psychiatrist, registrar, and mental health clinicians, and they will come to your wards, assess your patient, and provide you support. It may be that you just need a consult or you just want to ask a question, so reach out. Your nurse unit manager or your medical team will have the contacts for CL. Were there any other questions? No worries, Jess.
While we wait, if anybody wants to type a question in, feel free to pop it in the chat. But we are just over 12:30, and I'd like to thank Melissa for your time today and for getting us talking about trauma itself before we get into what trauma-informed care is. And like we spoke about, this was only a half-an-hour session, but we really wanted to put it out there to say, hey, it's not a totally new concept. It isn't something that is completely foreign. There are elements that we are already doing, particularly in aged care. I know there's a big focus out there now, but how do we build on what we're already doing, and how do we acknowledge that that is in fact trauma-informed care? Now, obviously, it was only half an hour, and we do want to continue to support all of you guys. So we will send you a survey after this session. And we really there's a question in there about, what else would you like to learn that relates to trauma or trauma-informed care? And please be as specific as you can. If you respond, it's because we are in the final stages of developing a program, and we want to make sure that we tailor it to meet all of your needs. So if there's particular topics or concepts that you think you would benefit from us covering, then please put them in there so that we can include that in the program. We also have 2 other programs relating to mental health support. So we have mental health first aid training program in June, which is a recognised program, and it's specifically for supporting older people's mental health. And we also have, facilitated by the lovely Mel, a mental health community of practice, which is a monthly program where you have access to Mel and all of her great knowledge and skills to help improve the mental health care for older people. So if you would like more information, we can send that out to you as well. But we would like to, oh, sorry, Mel, were you jumping in?
Yeah, just want to really quickly acknowledge something in the chat. So there was a comment around referring to healthy ageing services in TCP, and it looks like it's the St. V's catchment. So thank you for adding that. The other thing to keep in mind, because it's just the way the state works, is that there are different services for different areas. So, for example, Northwestern are very lucky. They have in the north and the west, so the aged care facilities, they're linked into a program through the PHN. called Older Minds, and they do mild and moderate counselling into aged care facilities. So that's only so. What we do find is that a lot of areas have different programs, but thank you for commenting on that one for us.
Thanks, Mel. Was there something else that just love more information on education resources for trauma-informed care and dementia care? Yes, I think supporting people living with dementia is, you know, a space that we find we need a lot more education in generally, let alone when we put that added layer of trauma on there as well. And that is a whole series in itself, I think, isn't it, Mel? But thank you. We have definitely got that on our list. And thank you. So I don't think there's anything else that's popped up in the chat, and we are 5 minutes over. So thank you very much for all of your time. Thank you again, Mel. And like we said, we will send you a link to the recording, which will be on YouTube, so you can share it with your teams, and also a copy of the slides. So Thank you very much for coming.
Thanks, everyone. Bye.